The skill I will be demonstrating is a dry sterile dressing change using a sterile field. The first thing that you will need to do is to assemble your equipment that you will need in order to do the dry sterile dressing change. And right in front of me I have a dressing change tray kit. I also have a sterile abdominal pad that I will be applying after removing the old dressing, and some non-sterile gloves. The first thing that you always want to make sure is that all your equipment is within the expiration date. We certainly don't want to be using any that has expired. And because you are a beginning practitioner, I really highly recommend that you set up the sterile field prior to removing the dressing, because we really do not want to have the wound exposed for any additional period of time. So that is what I would recommend. As you become more proficient, you certainly can do it either way. So the first thing I'm going to do is set up my sterile field, and you want a nice, clean, flat surface in order to do that. And as I mentioned, this is the dressing change tray, and I'm going to completely remove the top cover of it. And as you know from having learned about a sterile field, that we do have the 1-inch parameter that we can certainly touch around anything that is sterile. And this is why I am able to do so with this dressing change tray. The first thing that I see here is a garbage bag that I can just take off, and this is where I'm going to be placing my old dressing. So I can step back and I can actually open it up and place it in an area near the patient where I can easily put my old dressing. The next thing that I do see in my tray is my sterile drape, which I will need to apply on my table here. So what you want to do is take a corner of the drape, okay, and you do want to step back, because as you are opening the drape, you do have that possibility of touching the table, and that could contaminate the drape. And once again, you have the 1-inch leeway around, and as you can see, my drape, because it is made of paper, just began to tear a little bit. So you do have to be careful when you open the drape up. And you want to make sure you have plenty of room. Now, when I apply the drape onto my table, I do want to put the shiny side down. That's the moisture barrier. So I'm going to place it down like that, and I want it to be nice and flat. And then what I can do is take my sterile gloves that are also in my dressing tray kit, and I'm just going to take them out and place them on the side for now. I'm not going to apply them just yet. Now, I have a couple of things in the kit that I do want to place on my sterile field. There's a couple of ways that you can do it. I have a little kit within a kit that I can remove. And I can do so because this is a little tab that I am able to touch because of the 1-inch leeway. And I can just take that and place it alongside the edge. Now, as you can see, my tab is facing out. I can have it facing out this way, or towards me, or even on the other side. Okay, that's the best way to place it. I'm going to put it over here. It's because I'm able to touch this little section of it, and I want it facing away from my sterile field. Now I have some other items in here that I want to put on my sterile field, and when you tip this over, just be very careful. Many students don't realize that there is a great possibility of this to touch the edge of the sterile field. So I want to just place it over and kind of squeeze it out gently. Okay, and that's that. I won't be needing this, so I don't need to put it on my sterile field, so I'm just going to place it over here. The next thing that I will be doing is I want to place the abdominal pad, which I will need to place over the wound onto my sterile field because this particular dressing tray does not have this pad. So I want to open up my dressing and place it over my sterile field and gently put it down. And that's how you would put anything on your sterile field. You want to gently open it and place it over. And I'm going to discard it. Now, I have everything pretty much set up for my sterile field and for changing the dry sterile dressing. The next thing I want to do is I want to go over to my patient and I want to loosen the tape on the dressing and gently loosen it. I don't need to have gloves to do that. All I'm doing is just trying to take a corner of the tape so that I can get it started, because it's very hard to do with gloves on, as you will find. Gloves and tape are often not too compatible. But I'm going to gently loosen this so that when I do put on my non-sterile gloves, I will easily be able to take my dressing and remove it. Okay, I've loosened it enough so that now what I'm going to do is I'm going to come over here and I'm going to put my non-sterile gloves on. And I've removed a pair. And these can be easily found in most of the patient's rooms because with universal precautions, they usually have them in each room or very close by, you know, in the hallway for you to use. So you can bring in a pair before you actually remove the dressing. So I'm going to remove the old dressing right now. I do not need sterile gloves to do that. I need non-sterile gloves, which I have applied. And when I remove the dressing, I want to make sure that all the edges are loose, as I have done, and actually take the dressing so that I have it all in my hand, so that I'm going to take it as a unit and remove it. And as you can see, there is some drainage on the dressing. And this is something that you need to be aware of. The amount, the color, the consistency. Does the drainage have any odor? Because you will need to be documenting this information. So I have my old dressing, and a really nice way to just throw it away is to put it in your glove and then remove your glove, this one, and then with your other hand remove your other glove and discard it in your garbage bag. Okay, so now I am ready to apply a dry, sterile dressing to my patient's wound. So what I will need to do now is to apply sterile gloves in order to do that, because all my sterile material is on my sterile field, and I cannot touch that unless I have sterile gloves on. And in my kit, I have a pair of sterile gloves. Now, once again, when you bring the kit in, it really would be beneficial if you could bring in an extra pair or maybe even a couple extra pair of gloves when you first begin, because you might contaminate these gloves, and it would be better that you have a new pair of gloves on hand. Otherwise, you will have to leave your sterile field and you will basically have to start all over again. Because if you should leave your sterile field and leave the room, you really have to consider that it is no longer sterile, and you will need to get a brand new kit, because you cannot be sure that it will not be contaminated when you're out of the room. So that might be a good thing to do. So I'm going to take my sterile gloves, and I have an area over here that I'm going to put them down on. And as I notice when I open up that they are actually headed in the wrong direction. Usually the packaging gives you some indication of how the gloves are laid out inside. So I know that I need to turn this around. Okay, and it does give me a picture of the right glove and the left glove. So I want to open up the package as best I can, but remember, I don't want to disturb my sterile field here. Now, if you don't have enough room on the tray, what you can do is go to the bedside and apply your sterile gloves here. So you really have to just see what kind of conditions and how much room you have when you're doing this procedure. So the first thing I'm going to do is apply my right sterile glove. And I'm right-handed, so I will be taking the right glove, and I'm taking my thumb and a couple of fingers, and I'm going to try to disengage this glove from the other one without touching my sterile field. And once again, I need to step back. As if you recall, in application of sterile gloves, that we don't want to have any possibility of touching this table. So I have my sterile glove, and you notice the part of the sterile glove that I'm touching is the part that will be against my skin. So I will go now and proceed to apply my glove, and I found my thumb. Sometimes you do have to move the glove a little bit, and I have applied my first sterile glove. Now I need to go here and get my left glove on. So I really want to get my thumb out of the way and try to take either 2 or 3 fingers and touch the sterile portion of my other glove. Remember, sterile to sterile. I'm going to step back, and I'm going to apply my left glove. And once both gloves are on, you can make some adjustments just as long as you don't touch really close to the cuff. So now I have sterile gloves on, and I need to put a sterile dressing on my patient's wound. I don't need this particular item in my tray. I won't be needing my scissors or my safety pin. I will be needing the tape, which I certainly can put on after the dressing is covering the wound. So the first dressing I'm going to put on are my 4x4s, and I'm going to try to separate them out into 2 and 2 because this particular patient has a long wound. So I want to make sure that sterile to sterile, once again, my dressing is sterile and my glove is sterile. Sterile to sterile. I'm going to go back to my sterile field, and then I'm going to take my abdominal pad, and this will be the last dressing that I will be applying. Remember, this is just a very basic, simple, dry, sterile dressing. And then I will place it over. And now I am going to need to tape it. I do not need to tape it with sterile gloves on. Okay, it would also be very difficult. So at this point, my wound is covered, and the outside portion of the dressing certainly can be touched without wearing sterile gloves. So I'm going to proceed now to tape the dressing on. And here's my tape. I no longer really have to maintain sterility here because, as I mentioned, the wound is covered, and I'm concerned about taping it. And when you do tape it, you do want to make sure that you get all the edges so it's an air-occlusive type of dressing. Now, if my dressing should become wet, and I have the ability to change it, then I certainly would want to change it, because whenever any sterile materials does become wet or saturated, it is no longer considered sterile. So I'm going to finish up here. Okay, I've made an air-occlusive type of seal here with the tape, and I want to make sure that I'm going to put my initials and the date that I have changed the dressing in a corner, and I can do that with a piece of tape, okay, and a pen, and then just stick it on the corner. We don't want to write directly on the dressing in case it should become saturated or wet. That would not be good for pen to permeate the wound at that particular site. So I always want to put that tape right in the corner where it's not going to do so. And then I am certainly going to be picking up all the materials that I no longer need, and I will then make sure that my patient is comfortable and covered. And so this concludes sterile dressing change using a sterile field.